Intestinal diseases are quite common ailments in society. The intestines, which make up the longest part of the digestive system, can become ill for various reasons. Intestinal diseases mainly affect older age groups, but intestinal problems can occur in people of all ages. So what are the common symptoms and names of intestinal diseases? What are the names of intestinal diseases? Is there a treatment for intestinal diseases? You can find the answers to all these questions in the continuation of my video. What are intestinal diseases? Intestinal problems can occur due to the intestines not functioning properly or due to a structural defect in the intestines. In functional problems, when the intestine is examined with various diagnostic methods, no structural problems are encountered. In other words, the appearance of the intestine is normal. In functional problems, the main issue is related to the movements of the intestine. Most of the intestinal problems observed in society belong to the functional group. Intestinal diseases such as gas, bloating, diarrhea, constipation, irritable bowel syndrome, and food poisoning belong to the functional group. Structural intestinal diseases, on the other hand, involve the formation of abnormal appearances in various parts of the intestine. A wide range of damages, from erosion of the mucosa of the intestines to the formation of diverticula in the intestines, can cause structural problems. Diseases such as colitis, anal fissures, and hemorrhoids are considered structural disorders. The common types of intestinal diseases in society are as follows. Diarrhea. Diarrhea is a condition where the stool is watery and liquid. Also, there may be a frequent need to go to the bathroom in diarrhea. Diarrhea can be accompanied by symptoms such as nausea, abdominal pain, and weight loss. Diarrhea that lasts for a few days and resolves on its own usually does not lead to a significant problem in adults. However, it should be kept in mind that prolonged diarrhea can be a symptom associated with causes such as inflammatory bowel disease, irritable bowel syndrome, or celiac disease. Constipation. Constipation is characterized by difficulty in passing stool less than 3 times a week, and a decrease in bowel movements. The most common cause of constipation is the lack of enough fiber in the diet. Consuming fiber-rich foods, regular exercise, not delaying bowel movements when feeling the urge to go to the toilet are highly effective in improving and preventing constipation. Like diarrhea, when constipation persists for a long time, it should be remembered that this condition may arise due to another underlying cause. Prolonged constipation can lead to problems such as anal fissures and hemorrhoids. Irritable bowel syndrome (IBS). Irritable bowel syndrome, also known as spastic colon, occurs as a result of abnormal contractions of the colon muscles. Certain foods, medications, emotional stress can trigger irritable bowel syndrome. Symptoms of irritable bowel syndrome may include abdominal pain, excessive gas, diarrhea, or constipation, bloating, and changes in bowel habits, more frequent bowel movements, more watery stools, etc. Avoiding foods that trigger irritable bowel syndrome, reducing caffeine intake, consuming fiber-rich foods, and drinking plenty of fluids are effective methods in the treatment of irritable bowel syndrome. In addition to these, medications can also be used in the treatment of irritable bowel syndrome. Hemorrhoids. Hemorrhoids occur as a result of the dilation of blood vessels in the anal canal. Hemorrhoids can be divided into 2 main groups, internal and external. Internal hemorrhoids occur when the blood vessels inside the anal canal swell. These swollen blood vessels can bleed when straining during bowel movements, and they may protrude downwards from the anus. Treatment of internal hemorrhoids includes lifestyle changes to prevent constipation and interventions to address the problem with blood vessels, such as ligation or surgical procedures. External hemorrhoids, on the other hand, are the enlargement of veins just below the skin of the anus. Sometimes, straining during bowel movements can cause these veins to rupture, leading to the formation of a blood clot in the affected area. The area where the clot forms becomes very painful and uncomfortable. Treatment for external hemorrhoids involves removing the clot and hemorrhoid under local anesthesia. Anal fissure. An anal fissure is the presence of cracks or openings in the skin in the area where the anus is located. Anal fissures usually occur as a result of passing very hard or excessively watery stool. The cracks in the anal opening cause the muscles that control bowel movements to be exposed. These muscles become irritated when they come into contact with stool or air. As a result, severe pain, spasms, and bleeding may occur in individuals due to bowel movements. The treatment of anal fissure consists of consuming fiber-rich foods using pain relievers. Warm water sitz baths can also help with anal fissures. If these methods are insufficient for treatment, surgical intervention may be necessary. Colitis. Colitis is a general term for inflammation of the intestines. Inflammatory bowel disease, celiac disease, infection, exposure to radiation can cause colitis. Crohn's disease and ulcerative colitis are the two most common types of inflammatory bowel diseases. In these diseases, inflammation begins in the mucosa of the intestine, and this condition can spread deeper into the inner layers of the intestine. Again, inflammation in the intestine can affect a larger part of the intestine over time. Symptoms such as diarrhea, abdominal pain, rectal bleeding are the most common symptoms in inflammatory bowel diseases as well as in other colitis. Celiac disease is an autoimmune disease where the immune system attacks the individual's own intestinal cells due to gluten consumption. As gluten consumption continues, the damage to the intestine becomes more severe, and the individual's intestinal absorption mechanisms may be disrupted. This situation also leads to problems in the nutrition of celiac patients. Diverticulitis. Diverticulum is the term used to describe finger-like protrusions that form outward from the intestinal wall. Diverticula are particularly common in older individuals. Most diverticula do not cause any problems. However, when diverticula become inflamed, bleed, or cause obstruction in the intestine, a condition called diverticulitis develops. Treatment of diverticulitis is performed according to the severity of the disease. While sometimes resolving constipation is sufficient in treatment, in some cases, starting antibiotics and even surgical intervention may be considered. Colon polyps and cancer. Colon polyps are small finger-like protrusions that form inward into the colon. These protrusions, in the polyp stage, generally do not cause any problems, but they can turn into colon cancer in later stages. Therefore, when polyps are detected, it is necessary to perform the necessary tests for cancer and, if necessary, remove the polyps from the colon. Colon cancer is a very common type of cancer in the population. Treatment success decreases when detected in the late stage. Therefore, it is important for individuals over 50 years old to have a fecal occult blood test every 2 years and a colonoscopy every 10 years for colon cancer screening. While individuals with normal screening results wait for the next control time, individuals with suspicious findings in screening should seek medical attention without delay for further tests. Symptoms of intestinal diseases vary depending on the condition, but generally include similar symptoms. Abdominal pain, diarrhea, constipation, bloating, and nausea are among the most common symptoms of intestinal diseases. Seeing blood in stool, fever, and weight loss are also possible signs for individuals experiencing intestinal issues. It's recommended that individuals showing symptoms of intestinal problems should not ignore the situation and should seek necessary medical attention. We've reached the end of our video. If you found it helpful, don't forget to enable notifications, like the video, and subscribe to our channel to stay updated with our new content. Stay healthy.